What is the role of estrogen in schizophrenia in women? Have you ever wondered how hormones might influence mental health? Today, we are going to discuss the role of estrogen in schizophrenia, specifically in women. Schizophrenia is a complex mental health condition that often presents differently in women compared to men. One notable difference is the timing of symptom onset. In women, symptoms typically appear later in life and can show a second peak around menopause. This timing aligns with changes in estrogen levels, suggesting that estrogen may play a role in this condition. Estrogen is known to act as a protective factor against schizophrenia symptoms. Research indicates that women often experience more psychotic episodes during times of low estrogen. These times can include the menstrual phase, postpartum periods, after stopping estrogen therapy, and during postmenopause. Interestingly, during pregnancy, when estrogen levels are elevated, relapse rates for schizophrenia tend to decrease. This pattern highlights how estrogen can influence the severity and frequency of psychotic symptoms. On a biological level, estrogen interacts with specific receptors in the brain, known as estrogen receptor alpha and estrogen receptor beta. These receptors are involved in various brain functions, including neuronal development and synaptic plasticity, which is the brain's ability to adapt and change. Estrogen also has neuroprotective effects, helping to preserve brain cells and protect them from stress and injury. This is particularly relevant for individuals with schizophrenia, where brain function can be disrupted. Clinically, estrogen has been explored as an additional treatment for women with schizophrenia. Studies show that adding estrogen, often through patches, to standard antipsychotic medications can help reduce positive symptoms like hallucinations and delusions. However, it does not seem to significantly improve negative symptoms, such as emotional flatness or lack of motivation. Estrogen may also enhance the effectiveness of antipsychotic drugs, especially when estrogen levels are low. Animal studies support these findings, showing that estrogen replacement can reduce symptoms similar to those seen in schizophrenia when estrogen is deficient. However, there are some concerns about estrogen therapy. Potential side effects may include increased risks of cervical cancer and cardiovascular issues, which should be considered when discussing treatment options. In summary, estrogen plays a multifaceted role in schizophrenia among women. It influences brain function and symptom expression, acting as a natural protective agent. Its supplementation can improve treatment outcomes for positive symptoms. Hormonal changes, such as those occurring during menopause, can worsen schizophrenia symptoms, making it essential to consider hormonal status in managing this condition in women.